And new numbers tonight show COVID cases aren't simply creeping up in North Carolina anymore.
In some cases, they're growing exponentially. The state reported more than 1,400 cases today. Compare that to 55 reported cases just a month ago. Almost 1,000 people are now in the hospital due to COVID-19. The state still has less than 60% of the adult population fully vaccinated. Those numbers mean changes for our area right as school is set to resume.
Yeah, tonight we're live with team coverage on the latest impacts. News 13's Kristen Aguirre will have an update from local businesses.
But first, News 13's Anjali Patel has more on one school district's choice to make masks optional. And Anjali, this is not what state health officials are recommending.
That's right, Holly. Even though Governor Roy Cooper is lifting the statewide mask mandate in schools this Friday, state health officials are still strongly urging school districts to require students in grades K through 8, as well as unvaccinated high schoolers, to wear masks. But it's clear that will not be the case here in Madison County.
I was ready to pounce. I am a mama bear when it comes to my baby girl.
A lot of parents came to the Madison County Board of Education meeting on Monday night ready to make their case against masks.
I came in ready to give a big case, but now I don't have to, and I'm thankful.
Those arguments,
we're asking for parental choice for masks.
Unnecessary after many of them got the news they'd hoped to hear.
The Board of Education unanimously affirms that face coverings will be optional in our schools for the 2021-2022 school year.
And this decision comes as COVID-19 cases surge across the country and the region. In Madison County, they've seen about 50 new COVID cases over the past 2 weeks. Now, school leaders say they've reserved the right to change their decision on masks as they continue to consult with health officials.
I promise to continue to stay in frequent contact with school leadership and the Board of Education.
The county health director saying that COVID-19 testing will be provided to students and staff and that they'll continue contact tracing efforts within schools. But these measures are not enough for one woman who spoke up, a longtime volunteer at Hot Springs Elementary.
At a minimum, schools should have mandatory masks. All teachers and support staff should be vaccinated.
But for a majority of the people at that meeting, they believe masks are a matter of personal freedom and that their kids should have a choice.
And I want to see my teachers' and friends' faces this year, and I want them to see my happy face too.
Now, both the Madison County Health Director and the District Superintendent declined to comment further on the school board's decision tonight, and masks will still be required on school buses. That is according to a federal mandate.
The idea of more restrictions is worrying some small business owners.
News 13's Kristen Aguirre spoke to a local restaurant owner who says he's frustrated. Kristen.
That's right, Ty. The restaurant owner we spoke to tonight is pretty frustrated, saying the idea of going through another round of tough restrictions, especially right before the holiday season, could actually be pretty catastrophic for local businesses here.
So the table's ready for D. So should we get them?
Yeah.
Okay.
The sounds of a full house. Music to the ears of any restaurant owner.
We thought we were back. We've spent money that we felt needed to be spent to get us back on our feet.
Especially to Kevin Westmoreland, who owns Corner Kitchen in Chestnut. Now, he had to temporarily close the restaurants last year because of the pandemic.
I'm a little frustrated personally at 40% of the country that won't get the vaccine because, we're all vaccinated.
And with Delta on the rise, he's fearful it could happen again.
A shutdown at the state level could be pretty catastrophic.
I'm hoping we don't ever get to a shutdown.
A fear Jane Anderson of Asheville Independent Restaurant Association also feels.
We're a resilient group, and I think that probably everybody thinks if we have to go back to masks, we go back to masks.
But resiliency doesn't guarantee survival.
Will we make it through another shutdown? God forbid.
A little uncertain. A little scary.
But it's where we are. Right now, more communities in North Carolina are moving into the orange zone, which indicates substantial community spread.
It's frustrating to think that we would slide backwards.
A lot of these folks, the ones that made it through the first round of COVID, might not make it through this round.
Order up.
Now, during the last shutdown, Mark says he had to lay off most of his employees, including some here at the corner kitchen. He went from 70 employees to just under 10. He's hoping this time he does not have to do that.
COVID cases are on the rise here in the mountains, and health officials point to several reasons why.
News 13's Rex Hodge reports they say we all need to take action to get out of the orange zone.
Haywood County back in the orange zone for COVID-19, indicating significant community spread.
Orange means that there is accelerating spread in the community.
Haywood County Medical Director Dr. Mark Jabin says it's been a quick transition from 6 western counties in the green 3 weeks ago, including Haywood.
As of Friday, there are no counties in western North Carolina in green, and there's 7 now in the orange.
Jabin points to a combination of reasons for the increase in cases, including the Delta variant.
So you have the confluence of people letting down too much, and the variant being more contagious, coming together to lead to the surge that we're now seeing. The brunt of this is being borne by people who cannot or choose not to be vaccinated.
Health leaders, including Macon County's health director, are reinforcing the effectiveness of vaccination, around 90%, in preventing hospitalizations and death, while also acknowledging people's concerns.
And really that's about education. A lot of people want to wait some time.
People who feel like it's my right, my body, I get to make my choice, that is correct. But again, you're not being honest with yourself or fair to those you care about if you don't also factor in that the choice you make for yourself also makes a choice for somebody else.
Both health officials say wearing masks and distancing remain especially important now for the unvaccinated in high-risk environments, like crowded indoor spaces, especially with schools starting next month.
If we want to be in person in school, our best chance is to be as protected as possible. That includes the vaccine and masks.
As we move forward, we'll see possibly younger ages of children being able to be vaccinated.
Critical steps, as Dr. Jabin says, the case trajectory now is similar to what led to last winter's surge.
Now's the time for all of us to take advantage of what we know and what we can do to stop it.
Dr. Jabin says it's now advisable for those even fully vaccinated to put the mask back on when going inside into a crowded space that's not well ventilated.